Namaste, Dr. Rashmita here. I'm going to talk about pranayam. So, when I talk about pranayam, breathing exercises, breathing, so many of you are asking what are the basic aspects of pranayam and what kind of pranayam one should practice, and what is the basic difference between your breathing exercise and pranayams, what we are teaching you in yoga classes. So, let's understand about it. Whenever we talk about pranayama, it's like prana plus ayama. Prana in the sense the breath. It's not only the inhalation or exhalation. It's not only the oxygen or carbon dioxide we do inhale or exhale. It's like all those five pranas. We have a division of five pranas. All those pranas are carrying along, and you are exhaling the like physical prana, which is the energy being used. Okay, and then breathing exercise means where some of the practices are very rapidly doing or practicing it, which may or may not lead you to the spiritual practices, but definitely that is going to help the like the muscles or the organs or the like physical body which is in need of oxygen or in need of some of the changes happening in your body. So the pranayam practice, anciently it known as a kumbhaka. Kumbhaka in the sense to hold of the breath. So the lengthening of the holding of the breath, that is known as kumbhaka. And this breathing exercise are known as the modification of breathing practices according to the need. So when I'm talking about forceful exhalation, that would be to cleanse the lungs and to cleanse the nasal passages, where we should be doing some of the active exhalation, active inhalations. And the literal pranayam practice would be like anulom vilom with the count of holding. Nowadays we just mixed up with all those things like the pranayam practices, the breathing exercises, and people are not able to like define what should be the yogic practices and what is the breathing exercises. Let's learn about the pranayam, like it's simple yogic pranayam. So what should be the pranayam including of, like it should be inhaling, holding, exhaling. These three aspects of pranayam, the breathing is known as pranayam. So whenever you do inhale, there is an exhalation and there is a pause. The pause again divided into two parts, which is like one is internal retention, two is external retention. So when you inhale, hold your breath, then exhale. This is inhalation, internal rotation and exhalation. Like then when inhale, then exhale out completely, hold, and then exhale, that is known as outer retention. So these are the small basic like information about the pranayam. And about breathing exercises. So if you have seen, nowadays doctors are prescribing many of the heart problem people, or the high BP problem or the low BP problem. They are advising to practice some of the breathing exercises with the instruments. Like if your lungs capacity is going to decrease and the lower lungs is not able to release all those mucuses, the toxins from the lower lungs, and the oxygenation process is not going to happen properly in the lungs, then you are landing with all those lungs problem, asthmatic problems, the breathing, the allergy, all these things are going to happen. And when you land up all these things, those breathing exercises will help you physically to improve the length of the lungs, and the oxygen levels should be reaching to the body. So this is the basic difference. So whenever we are practicing it with all those instruments, how to improve your lungs capacity and how your breathing should be boosting and forcing with all those instruments, this are medically doctors also providing you. They will ask you to practice. But pranayama is like, it's the higher state of tapa. Higher state of tapa in the sense, tapas in the sense where you are constantly practicing something to achieve the mental ability and to maintain the physical strength and the getting into the state of trance. So both the needs are completely different. One is the physical illness is there, you are practicing to boost up it. The second is you are practicing it to improve the mental health, which is like your spirituality. So both are completely different. So the breathing process, the breathing exercises, we do it. They are there to increase your breathing capacity in your body, because that is gonna help you to get the energy. But when we're talking about pranayam, you are settling down your prana. So like the physical breathing, that is the prana, to achieve your mental thoughts. So when your chalit vatam chalit chittam, nischale nischalam bhavet. So it's like if your breathing is rapidly moving, then your thought is moving. When you cess your breath, automatically your thoughts are cessing. So in pranayam, that should be reduction of your thoughts, not to increase the breathing capacity. That is always there, because before the pranayam practice we do asana, automatically the lungs capacity increased, and you are getting the space to evoke the oxygen into you. So no worries about that. The basic difference is, one is for spirituality and the second one is for the physicality. So these are the few basic things you should be understanding when you are practicing yoga or pranayam. Then whenever doctors, prescribers go for a pranayam class or a breathing class, they meant to cure your the incapability of breathing capacity. And then being a yoga teacher, we will teach you how to be a spiritual with the yogic or the breathing practices. So these are the two different aspects of practices. When we are teaching in the class, that is a mixed form of breathing practices and pranayam, where you should understand about the physical limitation and you are practicing for the spirituality. Then it is a higher form of tapas, as I mentioned it. So we are preparing yourself automatically, where the meditation state is happening after the practice of pranayam. Then the relaxation state, where automatically you will see the level of alpha, beta, theta state of your mind is achieving without any distraction. And the asanas will make your body strengthen to sit for a longer time. The breathing will help you not to get any kind of pain in your physical pain during the practice of meditation. And then you are ready to get into the state of meditation, or then you can get the achievement of moksha or the nirvana, however you plan for. So this is how a map of yogic breathing and then yoga exercises or breathing exercises. Do understand properly and do practice. Even though we are teaching all these practices in our class, you can join us in the batch, where the 6:30 to 7:30 batch is open for everyone. We can adjust you according to your body type, according to your breathing, according to your need, and then we can teach you about that. So do join us, do follow us, do subscribe our videos so that you can automatically get a notification whenever we are uploading a new video. Thank you so much. Nice.